Hi students, as you know that the exams are just around the corner and I want to bring to you some very amazing tricks for difficult and tough questions that will help you focus on the question, that will help you have a strategy for option elimination and also how to guess. Now, as you have watched in the other videos before, and if you have not, I'm putting a link in the caption where I'm discussing the strategies or how many questions you should attempt in an exam. And we all agree that the more you attempt, the better it is. Now, out of 240 questions in the NEET MDS exam, if you attempt around 200 to 220 questions, you are going to get into a very competitive score. And that is what is desirable. So the first step is to filter out the questions that are not in your comfort zone. So you are going to eliminate 20 questions or so, the less the better, which you will not attempt. Now I'm going to show you some different types of questions and the strategies on how to, tackle them. So we will go through questions. The idea of this video is not to discuss the concept of the question. I've just picked a few types of questions, okay? So that we can apply different strategies to each of them in the exam. Now, the first type of question are very straightforward fact-based questions. These are the difficult ones to attempt if you are not sure. These kind of questions include enzymes in biochemistry, or dimensions of teeth, or dates, or founders, or people's names, or institutional names. Okay, so very fact-based kind of questions, numbers, cephalometric values, which are not very commonly asked. So all these are fact-based questions. So here, let me show you. I have picked mostly implant and prostate questions so that we can understand them from my point of view. The safe zone for implant loading has ISQ value above. Okay, now this is a numerical question and there is only one factual answer to this. If you know, very good. If you don't know, be very careful with factual questions if you are smart guessing because you cannot guess factual questions. But the way to decode the question is to understand the English, the language of that question. Now look at the safe zone and look at the word above. So break down what they are asking for. If you need a value for an implant to be higher, it will be better. So you should definitely not go for smaller options. Now it is possible that they may give you a very high value which is not even in the range. Suppose for ISQ, the values are from 0 to 99. The higher the value, the greater is the implant stability. And at a ISQ value of 70 or greater, it is very stable for loading. Loading means connecting the abutment and putting a crown on it. But if they give you an option of 100, which is not even in the range, so that would be, if you pick the highest number just like that, it would be wrong. But at least you can eliminate two options here now because they are the smaller numbers. Pick the higher numbers and pick one of the two numbers. That is what is smart guessing. So you have 50% chances of getting a correct answer. So I would pick either a 60 or 70 if I was not sure. Okay. Now that would increase your chance of getting a correct answer. So in factual questions, try to understand the language of the question and try to take cues from the question and then answer them. This is what is necessary. And like I said before, with factual questions, smart guessing may be tricky. So filter those out. If it is not something that you are sure about, do not attempt factual questions directly, especially the ones with enzymes and stuff like that. Okay, just don't arbitrarily choose one option and then ponder over it later. Then the next type of questions are the confusing kind of questions. Now, inherently, all questions would be confusing, but these are specifically those questions which may have more than one possible correct answers, right? And in these questions, my advice to you is to make sure that you are reading and eliminating all the options correctly because sometimes when you are in a rush, when you are in a hurry to look at the question and options, you will miss out the other option which might be very identical, and that could be the correct option, but because your gut feeling says okay, this is correct, then you will just mark the incorrect answer. Now let's take an example. For a patient with large inoperable palatal torus, large. Okay. The major connector of choice should be, and the options are strap, AP bar, AP strap, and horseshoe. Okay. This is very simple. In the first place, you'll be like, okay, AP strap, very easy. But look at the AP bar. Don't get carried away with the AP strap. Palatal strap and horseshoe definitely are not very good ideas. Horseshoe is also a very decent idea actually because it covers only the anterior portion of the tooth. So here, so horseshoe can bypass the torus very effectively. So horseshoe could be a correct answer. So here there are three possible options that would be correct. A lot of my students that I have spoken to, they picked AP strap in this question. Now, all of them have the palette free, except for the strap. So, strap is eliminated. But you see, there are multiple options. If you look at the indications of each of these in McCracken in the workbook, you will know that all of them are indicated for palatal tori. But rigidity of palatal of the horseshoe is not very good. So you have to eliminate one by one smartly. Okay, then if you choose a strap over a bar, which one is better? So a bar is more rigid and provides bigger space for the torus. So a palatal bar, AP bar, is better than an AP strap because in AP strap you need minimum 8 millimeters of strap thickness. So these are the kind of thought process you have to involve when you are dealing with option elimination. Because what happens is if you just look at the option and then you're like, oh, this is the answer because this fits, make sure you are eliminating other options because the other options may also be correct, but you have to find the best reasoning as to what that answer is. Now, there may be conflicting answers to such questions after the exams are over, and if you discuss with your friends, and you may feel that, okay, this is also correct, this is also correct, the answer key from different places would be different. But as far as you have a very valid justification, you should attempt this kind of a question. And these are very safe questions. They look very confusing, but the only problem is that you are not reading the options thoroughly. Okay, so eliminate the options even if you know all the answers. Even if you think that you know the answer, do look at the other options and make sure that you are eliminating them. Don't be in a hurry. Right. And the next type of questions are my favorite kind of questions, which students actually fear for no reason. These are very safe questions and they have a lot of information. These are the descriptive case-based kind of questions. Now, why are they easy to score? Number one is because they give you a lot of information. So, suppose you have to choose between diagnosing some odontogenic tumor. You are given a female who's in the middle age, has a swelling in the anterior region, okay, near the canine area, and it is a suspected odontogenic tumor. You have a radiograph. So, all of this information is a lot of information to narrow down your answer. Now, this would be an AOT classically, but you have to look for all the cues in the question. So, a lot of diagnosis related questions are usually case based, especially in medicine, in pathology, and in oral path, oral medicine. All of these surgical questions are case based. The approach to dealing with a case based question that I recommend is because they are very long, right? And you don't want to waste your time reading it again and again. You nearly have like 30, 45 seconds for one question. You don't want to spend too much time on a question. The best way to approach a lengthy question, if you see there's a big prose, just read the last line first. So, which type of cement would be the most appropriate to use for rebonding the veneer? In this case, the last line itself is an independent question. Which cement for rebonding veneer? It is straightforward. You don't need additional reading, but you must read the question because there might be something interesting in the question that applies differently for that clinical scenario. But before reading the whole prose, read the options so that you are prepared as to what to look for in the question. Zinc phosphate, GIC, resin modified GIC, and resin cement. Now, veneers are cemented with adhesive resin cement only, okay, because of the properties that are required for bonding. Zinc phosphate and GIC are definitely not used for veneer recementation or cementation, but people might get confused between resin modified GIC and resin cement. Remember, glass ionomer is not used for glass ceramics, okay? So these kind of things you have to use, apply your reading. You have read all of this. You have read the indications, contraindications of veneers. You've read the cements and their properties, you've read all of this, but when the time comes to apply, you have to eliminate one option at a time like this. Now let's read the whole question so that you can understand what I'm trying to say. 45-year-old patient visits your dental clinic, complains that her veneer on tooth 1-1 has rebonded, shows you the intact veneer, expresses her desire to have it rebonded. So this is just a story. Okay, it is just taking more of your time. You will definitely find such questions in the exam. One of the previous MDS NEET exams had a lot of these questions. Like the whole paper was filled with these questions, and the students could not even attempt reading all the questions because the questions were so lengthy. So remember to read the last line first, then read the options, then go to the story, and then if you need to read again to find more keywords and more information, look at that. A lot of times you will have images attached to these case-based questions, and the image will have important data. If there is a pharmacological kind of question, or if there is numerical values of tests, biochemical tests, look at those values. They are giving you some information. Okay, so eliminate the options based on the extra amount of information that you have in case-based questions. And these are scoring questions. So you should definitely attempt these and do not leave these out. Do not eliminate them when you are smart guessing. These are easy to attempt. Right. And the next kind of questions are the interpretation based questions. You have to interpret because you have an image. It could be a radiograph, it could be a clinical image. Suppose if you have an image of a patient with butterfly rash, you just go ahead with, oh, this is systemic lupus, but it could be other rashes. So be very careful. Don't be in a rush. Read the other options before moving on. Let's take a look at one of these kind of questions. Okay, here we have an OPG of a completely edentulous maxillary arch opposing a mandibular anterior natural dentation and missing posterior. Now, there is a very specific pattern of the resorption of the ridges here. The upper anterior is more resorbed, the upper posterior is more intact, the lower posterior is more resorbed, and the lower anterior dentation is intact. Now, this is a very classical case of combination syndrome. But what would go wrong? Now, when you are reading the other options, you will look at this option, which is anterior ridge preservation syndrome, which does not even exist. So you will have these fake kind of options as well in the exam. You have to be very mindful of filtering those out for option elimination. Don't be overconfident thinking that, okay, this you have not heard, so it's a fake option. Just because you've not read about it, it could potentially be actually a condition, not necessarily a fake option. So be very mindful of these new kind of terminologies. You see some extra syndromes or some new fancy word of, lesions. Be very mindful of these options because they are going to throw you off. The best answer is usually the simplest answer to a given question. So look at what makes the most sense at when you are looking at the options. Now, excessive maxillary ridge resorption. So this also a lot of people will think because on the radiograph it shows that there is excessive resorption, but you have to be more tactful. You have to be more mindful of what you have already read. You have to think about the concepts that you have read, prepared, and then attempt these kind of questions. Image-based questions are very safe if they are very direct, but if they are complicated images, sometimes the image quality in the exam is very poor. But if it is so, then you can skip to attempt it. If you are not sure completely, okay, skip it, no problem. But if it is making sense, if you can filter out at least two options, take a 50% chance, and I should say that you must, attempt as much as possible. Give these kind of questions a try. They are safer kind of questions. Then the next type of questions are actually the interesting kind of questions. You will see some colleagues around you also trying the same thing. And I also did similar kind of method in my exam when visual kind of questions come into picture. These are usually occlusion based questions or jaw relation kind of questions or muscle attachment kind of questions. And you are trying to be like, okay, what is it? You can kind of make it feel, you can visualize yourself by which tooth is contacting in which fossa. So you'll be like, okay, this is here and it's, You know what I'm saying, right? So occlusion based kind of questions where you can visualize, where you can actually feel it in your mouth and you're like, okay, this is here. The incisive papilla is how far from the tip of the central incisor. So these are the thought processes that you can do in the exam on your own, right? So these are easy to do because you are in the exam and you can feel it in your mouth and you can just, move your jaw around and figure an answer around it. So these are the concept based questions that require a visual acuity. I have used a denture patient here as an example, although we are not denture wearers. Maybe I don't know, but it kind of adds more to the perspective. Let's look at the example here. When establishing balanced occlusion, lingual cusp of maxillary posterior teeth on the non-working side should contact. Now, in a complete denture occlusion, balanced occlusion, there is contact on the right and left side, on the working and non-working side, even during movement. That means the patient is going to have maximum intercuspation. This is protrusion. There is posterior teeth contact. This is the working side. This is the non-working side. Working side is the side to which the jaw is taken. So if I move my jaw to the right side is the working side. In dented patient, left side, there is no contact. That's Christensen's phenomenon. But here in denture patient, for denture stability, you need contact. So the question is which part of the teeth are contacting, right? So this is more visual. You can move your jaw around and be like, okay, this tooth is touching here. So which tooth is touching where? That is the question. So maxillary posterior teeth on the non-working side should contact. This is the maxillary teeth on the non-work on this here. This is the maxillary posterior teeth on the non-working side. So upper teeth are contacting the lower teeth. Where is the question? So you can visualize this very easily. Lingual incline of the lingual cusp. It might be very confusing, right? The questions might be very difficult to interpret, but when you kind of use the technique that I just mentioned, it gets simpler. So I want you to comment in the video below what is the answer to this question, and then we can always discuss more doubts. I like when students post their doubts in the comments and we can always get back to you. It kind of initiates a conversation and we can look at other perspectives that other students might have on the same question. So don't hesitate in commenting on the videos. It is an open channel for everyone and we should always encourage a group discussion. Right. Now let's look at these kind of questions, the debut kind of questions, which are never seen before, never heard of before, absolutely fresh concept, very difficult to understand sometimes, and tricky, could be fact based. There was one exam, I think it was 3 years ago, NEET MDS, where there were a lot of maxillofacial prosthesis questions, and all of them are material based. Like it was very difficult for students at that time. So these debut kind of questions, they are not as difficult because sometimes the hint to the answer is in the question. Now I have picked this question. It is already something that you might have seen before, but it's a new concept and it's not been asked in the exam. That's why I've included in the video here. This is a long question. So what is the strategy? First, how will you design the prosthesis? We don't know what kind of prosthesis, so we have to read the entire question. But before that, we will look at the options. It says connect implants A, B, D, E with a metal bar and a cantilever of this much. Implants A, B, D, E and a cantilever of this much. Metal bar here. Implants B, D with a metal bar and a cantilever. Again, implants in the position and then cantilever. Now, suppose if I don't know at all what is A, B, D, E, what is B, D, what is cantilever of so much, I'm going to be thrown off. So now my approach should be to find as much information as I can from the question when I'm reading it thoroughly, because this is a long question. I don't want to read it multiple times, right? So, okay, we have an edentulous patient who comes to you for restoration of his completely edentulous mandible. We picked one keyword. It's a mandibular, completely edentulous arch. The posterior mandible has low bone height, so you decide for an anterior implant supported overdenture. So now, if you have read anything about implant supported overdenture, which I believe you would have because we have it in the notes, we have it in the workbook, we have discussed videos on it. So somewhere or the other, you will find a link to that topic. right? Most of the time in a new concept based questions, you will have some background information, very faint, but you will have something to work on. Okay. Four implants in the position A, B, D, E. So they have also mentioned that these are implant positions A, B, D, E. There are four implants. With implants B and D independently placed at a distance of 14 millimeter, the patient has high expectations. And now, how will you design the prosthesis? So they are asking you whether you should connect four implants or two implants with a bar. What does your common sense say? If there are four implants and there are two implants, which one is more rigid when you have a cantilever? What does cantilever mean? It means that here, if you look at this image, this is in between the foramen. Usually, if you want to give something only in the anterior area, you restrict yourself from foramen to foramen, mental foramen on either sides. This is the cantilever on both sides. What is mechanically more advantageous, using four implants and cantilevering, or using two implants to connect and then cantilevering? Sensibly, four implants. So if you read the question, it will make some sense. Now, this table is something that you might have seen in the workbook. You have read about it. I want you to go through it in more depth, right? Because there is a potential. This implant supported overdenture is a very potential topic when new questions can come from, because they have not come in the past and it's a very popular exam topic. Okay, so look at these tables. Look at the content that you have in the app, in the explanations, because they have the potential for new questions that you are not aware of. The new questions that are coming in the exam are exactly from the same data, same concept that you have gone through, but you skipped it or missed it, or because you did not pay enough attention to it. That is the reason why you are struggling with them in the exam. So, my advice to you for these kind of questions is eliminate the options which are really making no sense. But if it's a fact based debut question, then again be very careful because you don't know what to pick. So, bigger implants and bigger cantilever, what to choose? So, the answer for that is in this table A, B, D, E, as you can see here, and this is 10 millimeter cantilever. Okay. So, filter it down to two possible correct options that you think you can take a risk with, and then you should smart guess and approach the question tactfully. Then the next kind of questions are the mathematical kind of questions. Not a lot of questions, not a lot of concepts that I can think of, but because we were talking about implants, I thought it is better to brush on this as well, because you might require some calculation here and there. Now, I don't know about the access to pen and paper, but if you have, well and good. If you don't, then you have to do some mental math, depending on the exam, whatever. If it's an INI-CET or NEET MDS, pen and paper is always a concern. Now, mathematical questions require you to have some kind of calculation done, especially when you are dealing with implant related stuff. So, if two implants of size 4 millimeter are placed in an edentulous site, what should be the minimum required mesiodistal width of the ridge? Now, you know that one implant should have a distance from the other implant of at least 3 millimeter and from the natural tooth up to 1.5 millimeter. Some text also say 1 millimeter. So, if the calculation is not fitting in according to the options, it could be 1 to 1.5 millimeters. What do I mean to say? That means between two implants, there should be 3 millimeter gap. Between the tooth and the implant, there should be 1.5 millimeter gap. The question is asking you what should be the minimum required mesiodistal width? What should be the width of this area if you want to use two implants which are 4 millimeter wide? So you have one implant and one implant. This is how you don't have this image in the exam. So you are going to make an image in your mind. So they have to be 3 millimeters away and 4 millimeter each, and then 1.5 on each side from the tooth. So that's 4 plus 4, 8. 8 plus 3 is 11. 11 plus 3 is 14. So the correct answer to this would be 14 millimeters. So this is a calculation based question. These are usually easy to attempt if you know the concept behind it. But if you are just guessing in numbers, then you will mostly get an incorrect option. Just if you are guessing out of four, it is very difficult to make sure that it might be correct. But if you are filtering it down, somehow if you can get rid of two options, then it makes more sense to attempt that question. So these are some of the kind of many questions that appear in the exam. Now, of course, my advice to you is based on these questions. In the exam, you may have different kind of a question from this family, and you might have to apply a different strategy. See, each of you have to figure out your way of working towards these questions. And how do you practice that? You take mocks. Time and again, that's what I keep telling you. Take mocks because they give you the experience, they give you the idea, they give you, they build that kind of thought process in your mind for each kind of question so that you're more prepared for the day of exam. That is the whole idea of taking mocks. So if you are not taking mocks even now, please register for them and please follow the AI recommendations. They are very handy and they will really help you with the revision. If you have any more questions with regards to what are national mocks, what are these AI recommendations, all of that is in the caption. Just watch that video so that you are on board for your exam preparation. Now, one more thing I want to tell you is I know that at this point of time, revising all these subjects is difficult. If you have left behind some important part of your curriculum that you have missed out on, and you're stressed about it, don't worry about what is left. Focus on what you have achieved and focus on your strengths so that you can get more marks. See, whatever you have not prepared will not bring you any marks, but whatever you have prepared is what is in your hands and that is the thing that you should focus on. The mocks will give you more variations of questions. It will just add more idea of different kind of subjects and different kind of topics that you may have missed. But your aim should be to focus now on your strengths closer to the exam day. And if you have not gone through all the important topics and tasks from each subject, we have videos for them. You have seen them multiple times. I know we've been posting them again and again. Go through these list of tasks. See, have I covered the best 7 tasks or the most important 7 to 10 topics from each subject? And if you have, then you are in a good spot. Keep revising, and that should be able to give you a very good score. So, with this, I wish you all the best, and I hope this video was useful. Like our video, share our content with your friends so that they can make some good result out of it and share and learn. That is how we should grow. Thank you and all the best.